Hello, everybody. We are here at a brand new business in Berea, Kentucky, and this business is Nightingale Behavioral Health, and they are located here in Old Town Berea. So I'm going to scan around so you can kind of see where we're at. Old Town, the old hotel up there, Little Southern Class Flora. Straight across the street here is Club Arena Skating Rink, and we are going to get to visit this brand new business, and we are going to go inside and get to meet them. And so today also we get to introduce Debbie, and Debbie Warford is our chamber manager. So Debbie is going to be going in and interviewing this new business as well. So Debbie, lead the way.
Let's go on in. Hi.
Hello.
Hello. Welcome.
Thank you so much. Welcome to Nightingale Healthcare. We'll take you on a tour around and show you what we're all about.
Awesome. So tell us what your address is and how people can contact all your contact information before you take us on a tour, because people would love to know more about you.
Sure. It's 210 North Broadway in suite number 1. And our phone number, best phone number, is 859-756-3630 to reach us.
Awesome. And when is your official open date?
We are officially open today.
Woo! So for those watching, we're getting ready to have a ribbon cutting. But if you're watching this later, today is Friday, December the 10th of 2021, and this is the brand opening of a brand new business here in Berea, Kentucky. So I'm going to scan around a little bit and say hello. And you are?
Tress Middleton, and I'm a certified professional midwife, and we also have our house in Nightingale Behavioral Health. So we are here in Berea.
Awesome. And so you guys go ahead and take us on a tour, and we're going to let Debbie do some interviewing for you.
This is just a patient waiting room. I like a lot of plants, so we have a lot. And if you want to walk back through here, we'll start with Tress's space, if that's okay. It's right here to the left.
Awesome. So Tress, tell us about your space.
So my space is actually a double-use space. So I am here with Resilient Roots, which is Lauren Kellmeyer's. She is a clinical herbalist, so we share this space because we are both here about half of the week. So we just have a nice little like a visiting area. And then I also have exam tables as needed. And we have an apothecary that is Lauren's. So she houses all her herbs here. And this way we can just take care of both of our needs. And everybody has a nice little space. So
Awesome. So Debbie, you had some questions you were wanting to ask as well. So what would be questions that you would want to ask of this area?
So what typically what kind of clients do you see, patients do you expect to see here?
So for me, of course, because I'm a certified professional midwife, I see mostly 3 types of clients. I see clients who are pregnant and expecting, and then I also see people who just need their annual exams, because we do that also, or birth control. People interested in family planning, and then we also do lactation support. So anyone that's breastfeeding or chest feeding that needs help, or just some, is the baby tongue-tied kind of questions, we see them here as well. And then Lauren actually sees people of all different ages and different issues. She is really interested and works well with, trying to get to the bottom of what's going on with you, and she does a great job. So her clients really range from children to geriatric all the way through. So.
Oh, wow.
So you can start at the beginning. Do
Yes.
you do pregnancy testing here?
We do pregnancy testing, and we also offer free condoms here for those not trying to get pregnant.
Wonderful.
So we do offer free pregnancy testing for everyone, and I know that Rebecca will do that on times that I'm not here also. So
Wonderful.
we can do that.
Yes.
Awesome. So for those of you that are watching live or watching later, don't hesitate to comment, ask some questions. We'll always be able to get back on here and answer those questions and respond to those. So let's go back around to the other direction here. So beautiful little waiting area. Love it. And Rebecca, lead us on.
Come on through here. This is just a community sort of workspace, a group workspace where Tress, our midwife, myself, Ed Eastonhog, Dr. Eastonhog can come and share workspace. We typically have some chairs around here. This is where you'll be greeted by our office manager, Delissa, and you'll see her here on the other side of that window.
Awesome.
And then follow the owls on the floor to Dr. Eastonhog's office, and Dr. Ed Eastonhog sees a lot of different patients and clients, and he sees folks for disability, diagnosis, clarification, testing for specific mental illness or wellness, and so he sees folks here in this space.
Awesome.
And more of his services are going to be on our website, which is coming up soon.
So do you have a website address yet? Do you know what it's going to be?
We don't yet.
Okay.
We don't yet. I'm working on it.
But you do have a Facebook page, so they can always like that and follow that.
I do, for sure, for sure. And if you follow these little birds, they're into one of my main office spaces. And this is where you'll come, maybe for an initial diagnostic evaluation. Basically, that's fancy talk for me getting to know what your goals are and what you want to work on. So you'll see me here.
And tell us a little bit about who do you serve? What is the type of average person or client that might come in?
Sure, I see. I'm double board certified as a family practitioner and as a psychiatric nurse practitioner. So for my mental health and well-being patients, I see folks as young as 2 to 3 and on up to through the lifespan to geriatric clients who might have dementia or just some cognitive concerns, and everybody in between. And then for my family side, I do see folks for acute illnesses, ear infections. We do STI checks here and treatment. We do belly aches. We see folks for belly aches, ear infections, colds, strep throat, all of those kind of things as well.
Oh, awesome.
Yeah.
And so when you talk about family, that could be families of all kinds, right?
That's exactly right. And that's something that's important for Nightingale Healthcare, is that the community knows that we are very welcoming and we're a safe space for all types of families, however they're formed, and that we will see each and every one of folks regardless of their identification or gender or anything. So yeah, we're here for you.
Awesome.
Yeah.
And so if we look over there behind Debbie, under Debbie's feet there, you mentioned that there's 2 different types of stickers on the floor.
There is.
So explain the stickers.
Well, our office assistant, Jill, has made these lovely nightingales for my office because folks kept kind of getting a little bit confused as to where do I need to go. Because on the outside, this office doesn't seem that big, but once you get in, it is a little bigger.
It's really spacious. I was surprised.
It is. And so the nightingales lead to my office, and then the owls lead to Dr. Eastonhog's office.
Aww.
Yeah. And if you want to come on back this way, through here, I have another treatment room. And this is just a space, again, for folks to come and talk and that sort of thing and receive treatment.
Awesome.
Yeah.
So does your business accept insurance?
Yes, we sure do. Almost all insurances are accepted here. All Kentucky Medicaids and private insurance, and we can do self-pay as well, however a person might need to do that. Wonderful. Yeah, good question.
And what about business hours?
Business hours right now, we're open Monday through Friday. I see patients Monday through Thursday, and then have an administrative day on Friday. But there is someone in the office on Fridays 9 to 12. The rest of the my office mates may have a few different hours as you schedule, specifically with our midwife, considering what she does. She may not be able to be at all the office hours, but she certainly will work with all the folks.
I would say duty calls sometimes, and she might have to be on, right?
Exactly. Yeah. If you want to walk through here, I need to put a little lamp in here, but this is just a little diagnostic space where I can measure weights and heights and that sort of thing. And then through here is a different kind of room than the other rooms you've seen so far. It's more of the space that I might see a family practice patient for ear infections or belly aches or strep throat or STI screenings or women care. That's also what I do. I do PAP. We do PAPs and breast screenings and things like that.
Wonderful.
Yeah.
So you truly do serve the whole family here. All
We do.
It's a very well-rounded clinic.
Yeah, yes, I think so. I think that we're trying to reach out as much as we can and serve the community where we can.
So I have a question for you.
Okay.
Nightingale Healthcare. What made you come up with that name?
Well, it's twofold. One is I love birds, and the little nightingale has a special meaning. It kind of is showing that despite hardships, the nightingale still sings. And so when you look that up, that's kind of her meaning. And then the other part is that Florence Nightingale was a pretty significant, one of the first nurses. She was a war nurse. And so that was the secondary reason for choosing Nightingale.
What a cool story. I love that.
Yeah, it is.
And then second question, why Berea? What made you choose Berea to locate?
I was a Berea College graduate about 19 years ago.
Congratulations.
Thank you. And decided, my husband and I moved back to Berea, and I was a nurse practitioner, family nurse practitioner here for a while. And then I saw a huge need, an ongoing need for psychiatric care. So I went on back to get the psychiatric part of my certification, and here I am. And it's been doing well so far. Yeah.
That is a very much underserved area. Very much underserved. So we very greatly appreciate you locating here in Berea and coming back home to Berea College area.
Yeah, for sure. And we're reaching out, even beyond Berea to little communities surrounding. There's a need in our community surrounding.
So is there a target area? Can people come here from all over the region to come to visit you?
They can. I actually do telehealth as well for behavioral health. So I have patients in Eastern Kentucky that may not be able to motor on in here. So I do telehealth for them.
Well, and that's also great it's great for those individuals that just can't get here, whether it's transportation or whether maybe there's other issues that they just aren't able to be around other people for that ability to be able to be served by a doctor.
That's right, especially during COVID. That's another variable that we have to consider. Folks who may have more autoimmune issues that shouldn't be around a lot of folks, we can offer telehealth to them as well.
Awesome. Yeah. So how does someone contact you? Again, we mentioned at the beginning of the video, but go back over that again. How would someone contact Nightingale Healthcare to get started?
Sure. First off, we have our phone number, 859-756-3630, and working on our website, and you can also find us on Facebook as well.
And then what is that process? When somebody comes in, are they able to get an appointment pretty quick, or is there a long wait?
Right now, there is not a long wait. Typically, we can get most folks in within about 2 to 3 weeks. And if there's something acute or some type of crisis, then typically we can get people in sooner than that.
Awesome.
Yeah.
And then how about referral sources? Who are typically referral sources for your business?
Other providers here in Berea, and then also in Richmond, from London, referrals from Lexington as well have been coming in from other psychiatric and, not psychiatric NPs, but family NPs, doctors, licensed clinical social workers. All of these folks have been referring.
That is awesome.
Yeah.
Rebecca, this is so exciting. So I'm going to turn back around and let you lead us back out through the other room.
All right. Come this way.
And of course, remind everybody, today is Debbie's second day. So today's day 2, and it's her first ribbon cutting. So
Awesome.
Rebecca, you and Debbie will get to share something in common.
Yeah, for sure. I'm not sure, we just have bathrooms back here, but I do have my lab back here.
Oh, awesome.
As well.
The sneak peek at the lab.
Sneak peek at the lab. This is our little lab.
Wonderful.
And this is where you might come if we do genetic testing, and sometimes for mental health. There's a lot of sometimes trial and error with a lot of mental health medicines, and I do medication management. So sometimes we can consider genetic testing for you, and also we draw blood as needed because a lot of meds require that just for monitoring. So that's what happens back here.
That's hugely important too. Sometimes people don't realize one med doesn't fix everything. You may have to try, and you may have to try different types.
It's true. It's true. And patients can sometimes get frustrated with that, and it's certainly understandable. So sometimes, when it's appropriate, we do offer that genetic testing to allow maybe a shortening of that trial and error period.
And what's your average turnaround time for results, to get results back from testing?
7 to 10 days.
Awesome.
Yeah, it's pretty fast, actually.
Yeah.
Yeah. So this is our space where we'll draw blood and chest, and where we'll do urine screenings for pregnancy and for STI checks, things like that. Mm-hmm.
Wonderful.
So, yeah.
This is a very large office. It is deceiving from outside because
It
it's
really
a very
is.
large building.
Mm-hmm. It really is. It kind of winds around, for sure.
Well, and it's great for that privacy for the different patients,
It
for
really
the different types.
is. It really is. It seems at first like it's so small, and we are very, very private for our patients. We keep their confidence. We have wind machines and things like that, so everyone can feel more comfortable sharing.
Wonderful.
Mm-hmm.
Well, I'm so excited for you. And your
Thank
ribbon
you.
cutting, of course, to remind everybody, today at noon is your ribbon cutting.
That's right.
And this video, although it's on Facebook Live, we do move things over to YouTube too, so the video will live on. So it'll be neat for you to get to go back later, celebrate your 1-year anniversary, your 10-year anniversary, and go back to see
It
day
will be
one.
neat. Yeah, it will be. That will be neat. Yeah, for sure.
So,
Sure.
is there anything else that you'd like to share with us? Any other questions you might have, Debbie?
Let's give them the address one more time as to where we're located for the ribbon cutting for people wanting to join in on that.
Oh, yes. So the address for your office is?
210 North Broadway, and it's suite number 1.
And you are right here in Old Town Berea.
Across from the roller skating rink.
Yeah, Club Arena. That's pretty
Yes.
iconic. If you can say Club Arena, people know where
Club
you're at.
Arena, across from Club Arena. Yes.
Well, we greatly appreciate you guys being here today and being part of it. And we are so excited to celebrate your milestone with you, Rebecca. This is so cool.
Thanks so very much for coming over. We really appreciate it.
And we're going to remind everybody again, if you're watching, don't hesitate. If you've got a question, if you've got a comment, please share the video. Help us get the information out that this brand new business is here. And like Rebecca said, huge, huge underserved area, and having that ability to serve our community. And we are so blessed to have you today. So thank you so much. And we are looking forward to a great ribbon cutting. So
Awesome.
everybody say hi.
Thank you.
And we will see you again soon. Maybe on your 1-year anniversary, we'll get to do another follow-up video.
I would love that. Thank you.
Awesome. Have a great day, everybody.
Thanks.